So welcome. This is the Leadership Award. Dr. Jess Harvey, Clinical Director for South East Shropshire Primary Care Network and GP Board Co-Chair. And with me also Tanya Etkin, Chief Product and Marketing Officer, Chartered Management Institute. And I think you'd like to say a few words.
Yeah, hi. Thanks, Victoria. And congratulations, Jess. For CMI, supporting this Leadership Award is not just about celebrating individual success. It's about recognising all of those managers and leaders who go to work every day and make healthcare a better place. And the NHS is navigating a once-in-a-generation period of change and evolution at the moment. And, driving forward the 10-year plan requires new kinds of leaders and those that can really bridge the gap between national strategy and community-led care. And Jess Harvey's work has been transformational in that sense and really demonstrates how professional leadership can transform patient outcomes and reduce health inequalities. She's transformed patient outcomes in one of Shropshire's most deprived areas by uniting clinicians, residents, councils, and some of the results that achieved, an 81% increase in GP appointments is just fantastic, and it is a real demonstration of what professional leadership can deliver. So congratulations again.
And what do people care so much about is getting through that front door to see their GP. Look, we've only got 10 minutes, and I'm about to take up that 10 minutes without you saying a word, because I'm looking at what's been written about you. It says, your achievements include creating a community health and wellbeing centre, establishing a dementia integrated neighbourhood team, launching career connect groups, developing a PCN pain management service, delivering the Heart Failure at Home project, establishing women's health hubs, driving public health innovation. Do you ever sleep?
Poor Rachel, who spent the night with me last night, will say that no, not really. I talked all the way through my sleep as well, and fidgeted. So yeah,
what, coming up with other ideas?
Yeah, who knows? I have the sort of personality where I accept and acknowledge that I'm kind of always on the go, and I'm probably a nightmare to work with, and I'm sure some of my colleagues dread when they see the look in my eye that's a new idea. But I'm also incredibly lucky, and the only reason that I'm sat here today is because I've been in an environment where I've had great people to work with, and they've come along with me. And when we've had the 2:00 in the morning idea that was the Health and Wellbeing Centre, I sent an email to my colleague, and it was literally 2:00 in the morning. I've still got the email I use in the presentations saying, what if we did this? And they said yes, and we went with it. And there were times when we thought, is this going to happen? And we turned around and like, well, no, we've got to make it happen. And I've been in a place where people will support, nourish, encourage, put up with, sometimes have to put the brakes on a little bit with me. But yeah, I'm incredibly lucky.
Where did it start from? What was the initial impetus for this?
So I once had a coaching session, and the guy described my career as chaos, which is fair enough. But basically, I never planned to be here, and if someone had told me 5 years ago I'd be sat here in this position with this, I never would have believed you. So things have happened, and I think I've just taken opportunities, and I've taken a leap of faith when it's arisen. So it kind of kicked off, I guess, partly during COVID. I helped lead on the COVID campaign, and then when the PCN director for our PCN was stepping down, I blinked first when there was a couple of us. So then I ended up as PCN clinical director, not really understanding any of the lingo, and had to spend most of the meeting saying, sorry, but can you explain this? Sorry, but what's that? Sorry, but what's that? And actually I was really lucky, because my other CDs in that space said, I was saying, I feel awful, I feel so out of my depth, this is terrible. And they said, the problem is you didn't see when we were in your shoes, you didn't see when we had to ask those questions, and you assumed that we did. And that's what I tell new people now, is that you don't see that journey that they've had, you just see where they've got to. So I was lucky in that respect. I guess. And I think because I'm new to that space, I'm in a way slightly naive with it, which means that when someone said, so the dementia integrated neighbourhood teams, when they said we can't work together because we're from different organisations, like we're the local authority, like we're Alzheimer's Society, we're this, we couldn't have a meeting together, we can't share data. And I was like, well, that just sounds crazy, because like it is. But that's the culture that they've been through, and that's what they've been driven through. So actually, when you come at something from a completely different angle and you're not tarnished with all of that, then actually you can see from a different way. So I guess that's probably what I bring.
I mean, right through this conference so far, there's been a whole lot of discussion about the importance of collaboration.
Yeah. And
yet we know that there are people who tend to work in silos, and you've said it yourself. You go to the local authority and they say we can't share the data. So how did you overcome that, really? How could you say to them, this is for the patient, think about the patient?
Yeah. Well, look, listen, ultimately, anyone who's working in the NHS or surrounding systems, they all genuinely have like the patient at the heart of it. No one goes to work to do a bad job, right? So everyone's there to try and do the right thing, and sometimes it's trying to explore with people what they need to get out of it, what their issues are. So like I've met with people from secondary care, and I've started off with saying, what's your issue with general practice at the moment? Like what's the problems that you're having from us that we can help you solve, and what can you solve for us? So it's trying to help people see that, I'm forever saying to people, listen, we are all on the same team, we're just on different parts of the pitch. And the sooner we realise that, it's a bit like The Apprentice, right? You watch The Apprentice, sorry, terrible TV habits. You watch The Apprentice, and in the first few episodes, they're all desperate to be the one that shines, and they're all desperate to be the one that puts down everybody else. And about halfway through, they realise that if as a team they win, no one gets sacked. And there's that penny drop moment when all of a sudden they think, oh, actually, if we all work together, none of us get sacked, we all get through to the next round, and then we're going to progress. And that's what we're kind of doing within the NHS, is we're realising that actually, instead of just sort of fighting between people or doing one thing here, one thing here, one thing here, and actually there's some duplication, like we're greater than the sum of our parts. So in doing that, then that's where you get your wins.
I mean, it also says here you consistently bridge general practice, community services, local authorities and the voluntary sector, delivering measurable benefits for patients, carers and practitioners. Now, I'm interested in that measurable benefits, because we know that no matter what innovation or leadership there is, the bottom line is you've got to show that benefit.
Yeah. And and when I first came into this job, I was like, oh, it's fine, we'll do this and it'll be great. And we had a visit from Claire Fuller, actually, and I was like, oh, isn't this wonderful? Look at my health and wellbeing centre. She said, yeah, but what's the figures? And I was like, well, they're more. And she was like, but what's the figures? And I was like, yeah, got me. So she gave me some homework, and like a week later, I sent her an email. I said, there you go, there's the figures. And so
what's the emoji for that one?
I don't know. There's a few I could use, but I don't know. But no. So there's a reality, right? Is you can do all the great stuff, but unless you can prove the benefit, then upscaling, having it elsewhere, or getting funding, proving a business case. We don't, in the NHS, we're afraid of saying like a business case, because it's patients. We don't want to talk them like a business. We don't like to say that. It's like GPs are a private business, but it feels awkward saying it. But what you have to realise is that there's a reality here. If you want funding, if you want to try and upscale things, if you want to persuade someone to do something, the only way you're going to do it is by proving that. And so the dementia integrated neighbourhood team that we did, I went to the LMC saying, this is what I want to do. I want to set up a group of people who can talk about the challenging, the sort of patients that are having issues with dementia, from so social care's there, the memory team, the admiral nurses, the dementia link workers, our care coordinators, all of those people, all in that room, and they will sort it out, because as a GP I have very little to offer once at their stage. And I went to the LMC and they ate me alive. They're like, you're going to send extra work to general practice, it's going to be terrible, we're in a really difficult state. And I was like, I genuinely don't believe that'll happen. They were like, oh. I was like, fine. So we did it in my PCN, and over a year they had I think about 38 case discussions, and there were 2 things that went to a GP to do. One was to organise some bloods, and one was to review a carer. So 38
which is
people.
Hardly onerous, is it?
So 38, but that was 38 people with really complex issues. And when you extrapolate that out and thinking, well, I reckon at least 50% of those probably would have ended up in A&E, which costs 80 quid to walk through the door. The average stay for dementia patients, 12 days. So already you're in the thousands. So effectively, we've directly saved our ICB like over 100,000, like just with that. So you can look at it that way, and and I think it cost about between 5,000 and 6,000 to actually, in terms of man hours a year to run. So the cost benefit of that is incredible. But actually, the bigger benefit then is also seeing the patient's stories that go with it. Seeing the patients and getting the emails from the relatives saying, "Oh, it was great that you organised that you sorted everything out for me," because they think it's happening already, and that's what gets them, is when they get pushed from pillar to post and they don't know, and they're getting shoved around the system, and that's what makes patients angry, and I understand that.
Well, Dr. Jess Harvey, you are a wonderful leader, and congratulations on this very well-deserved award.
That's
Thank
good.
you.
Thank you. Thanks.